Hi, I'm Dr. Michael Cottam. I am a pediatric dentist and the site director for the Roseman Dental Clinic that is co-located in the Cure for the Kids treatment facility. The mission of this clinic and the partnership between Roseman University and Cure for the Kids was thought out and designed to bridge a gap that we recognize in children's health care. And specifically that gap is that for many families who have a child who is struggling with some kind of systemic disease, be that cancer or a bleeding disorder or any of a number of things, it can be very challenging and difficult for the child and family to receive appropriate dental care. Cancer, to use an example, takes a huge toll on everyone in the family. There's a lot of stress, there's a lot of energy that goes into that, and Cure for the Kids and Roseman University felt that anything that we could do to make any of that constellation of challenges easier was worth doing. So we've started on that journey by locating a specialty dental clinic here in the building right next to the Cure for the Kids facilities. A cleaning is the same cleaning as it is for everybody else. Sometimes it's not. Cancer is a great example of this. Sometimes there are medical precautions that have to be taken in advance so that we don't trigger an infection in the body of an immune suppressed individual who can't deal with that infection, right? But sometimes it's more about remembering that there's a person attached to those teeth. A cleaning isn't just a cleaning, this is a medical experience. And let's say for a child who has spent a lot of time in physicians' offices and maybe in and out of the hospital, or has a number of needle stick experiences because they have a lot of, they need to get a lot of blood draws or infusions or those kind of medical experiences. Dentistry is one more medical experience, and so it's entirely possible that there are extra stressors here that are part of this child's experience and outlook to medical care of any sort. In my background, so I'm trained as a pediatric dentist, which means that I do dental school, the initial dental education right along with everybody else, and then I do pediatric dentists do 2 to 3 years of additional training that has to do with children's psychology and children's behavior and children's growth and development. The specialty of pediatric dentistry is usually where dentists who have some expertise in acute medical care are exposed to that initially. After I did my pediatric training, I was in private practice for a while, and then I actually decided to transition my practice to hospital level care because that was what I was really interested in. That was what I found to be the most challenging in the way that I thought that I could best serve patients. So I served for several years at a children's hospital on the East Coast. I was chief of the hospital department there, and while there, that's kind of what large multidisciplinary medical teams do, right? We learn together. That was one of the fascinating parts about what I do is as dentists and physicians, there's no way we can know all of each other's worlds. That's just not our training, it's not our background. But the nature of the care that we provide is that we need to learn about each other's worlds so that we have the information. The university and clinic have received a huge amount of very generous support from a number of high-end dental equipment and supplies manufacturers. These companies and so many others have offered very generous support, both financially and in terms of the equipment that we have here.